Hello, my name is Ian Battersby. I'm the Pharmaceutical Stewardship Lead for Mars Veterinary Health. I've been in position just over 2.5 years. My background is I'm a double-boarded internal medicine specialist, both European and RCVS, and I'm also a fellow of the Royal College of Veterinary Surgeons. It's looking at how we use our medicines responsibly and optimally for our patients. So primarily, first of all, making sure that when we use them, the outcomes are optimal, we use the drugs in the right way. But then secondly, making sure that there's no negative impacts on the patient or future patients. What's really exciting is collectively across all of our hospitals around the globe, we have a massive potential to have a positive impact on good stewardship. One of our areas of focus is antimicrobial resistance and antimicrobial use. And, for me, part of the reason why I do this job is, because of the reach that we have across the globe. We've got hospitals in the USA, Europe, and Asia, and all of us making incremental adjustments to how we use our drugs more optimally collectively has a big impact. The World Health Organization has deemed AMR as one of the top 10 health issues facing our society. But we do have this window of opportunity. What we do know is that the more we use antibiotics, the more the bacteria have an opportunity to learn how to resist the effects of those drugs. So we want to make sure that we minimize the use of drugs unnecessarily. We use as short a course as possible. And activities such as World Antimicrobial Awareness Week really highlight the importance of this subject because we all have a role. And one key component of that is education of the owners. So that's why we think it's important that owners are part of the discussion, and we've put together some resources that can assist you with that dialogue and discussion and hopefully answer their questions. So one of the great opportunities that I've had in my role as well is to undertake research on antibiotic use. And compared to the studies that I've done in the past, one of the massive advantages for me was just the scale and size of the data. We were able to collaborate with universities and academics who assisted us in analysing that data. And to give you an idea of the scale of the publications, in one study we looked at almost 900,000 dental procedures, which is a huge amount of data. So firstly, that clinicians are reflecting not only on the prescribing for the individual patient, but the impact for longer term. And those discussions are happening regularly in the clinic. Ideally, again, those discussions on how we use drugs would be done in a very constructive way within our clinics, where everybody's comfortable discussing use of their medications and looking to optimize and improve their use and see if there's opportunities to change. You can't manage what you don't measure. But one of the challenges with that is not feeling judged when you start looking at those assessments. So it would be fantastic if every 2 to 3 months, clinicians across all our hospitals were sitting down, looking at the metrics of drug use across their clinics and talking about ways that they can evolve and optimize the prescribing of medication.